Hello everyone, this is Dr. Uma. Today I am going to discuss about grief and bereavement of children. First we will see about definitions. The first definition is grief. So what is grief? It is the total emotional experience or reaction to the expected or actual loss of lovable or valued person or thing. This is nothing but the total emotional experience. Otherwise, the human gives reaction towards the expected loss. It means some valued person is going to die after some time. Okay, or actual loss. It means some lovable person died already. So overall we can say this is a total emotional experience or reactions to the expected or actual loss of lovable thing. Next we'll discuss about bereavement. So bereavement is the period of surviving person subject to response after the death of loved one to whom he or she shared a mutual significant relationship. So it's a time period when surviving person gives some kind of subjective response after the death of loved one. Next we'll talk about factors influencing grief. So the first one is the human development. According to the age of the children, the understanding about the grief will be different. For example, infant, toddler and preschooler are unable to understand the meaning of the loss. At the same time, school age children understand that death is not reversible and relate to the death into sin. And adolescents understand the meaning of the death and hardly try to cope with the grief. Next, about sex, always men are stronger than the woman in the process of grieving. Even they will not show their grief to others, but women used to cry as a reaction of the grief. Next one is the psychological perspective. According to the psychological understanding of the person, intensity of the grief will be there. For example, if the person understands the nature of the loss, he or she may cope with the grief as soon as possible. Next, about the socioeconomic status. Generally, the intensity of the grief is more when the family lost the earning member. Right. Next, personal relationship. Loss of loved one to whom he or she shared a mutual relationship with the intimacy gives greater anxiety and grief. The last one is the nature of the loss. According to the nature of the loss, I mean people used to overcome the grief. For example, people actively cope with the death of loved one if happened due to old age. At the same time, they cannot cope easily the grief. Suppose the death occurred due to accident. Next, we'll see about types of grief. There are three types. Number one, normal grief. Two is anticipatory grief. Number three is the complicated grief. So first we'll talk about normal grief. So what is normal grief? It is the self-limiting one, and common symptoms are used to reduce gradually. Here people have enough acceptance regarding the reality and nature of death. So it's a normal process. It means that everyone knows that after a loss of loved one, anyway the people is going to back to their normal life. Okay, they are not going to die with the died person, right? So it's this kind of grief, we can say this is a normal grief. Next one is the anticipatory grief. It's a process of letting go occurs before the actual loss or death of the loved one. I mean, the grieving person knows very well their loved one is going to die after a month or after a year, 2 months, whatever, right? So here they knows they are anyway they are going to die. They can't do anything. So during this period, after carrying the dying person, automatically the process, I mean letting go process occurs before the actual loss. It means they didn't die, but even though they are going to die, they are about to die, so they will accept the loss of the person and they will go back their normal life. So that's why we tells that it's anticipatory grief is very painful than the normal grief. Okay, then third one is the complicated grief. See, complicated grief occurs when an individual has a problem in processing the normal life after the loss. Once the person died, but after a after a month, otherwise after a according to the nature process, they have to come back to their normal life. Suppose they are unable to do these things, then we can say that kind of grief is called a complicated grief. Okay, so this is also having two types. That number one is the chronic and delayed. So this is about signs and symptoms of grief. So the first one is the tightness of the chest, shortness of breathing and choking may there once the people feel the grief, dryness of the mouth and throat, empty feelings in the abdomen, uncontrolled trembling. Trembling means shivering. Okay, then loss of appetite and sleep will be there. Headache and diarrhea can happen. Lack of energy and fatigue will be there. Feeling of anger and guilt. So this is very common. If anyone died or anything, something lost, the grief person will be feel that this is due to happen because of them, and also they will have anger towards the God. Why it happened like this? And finally, social withdrawal. Social withdrawal is nothing but they will not talk to, otherwise they will not mingle with the other people in the society. Okay, this is about the signs and symptoms of the person who is in grief. This is about stages of grief. See, in 1969, Elizabeth Kubler-Ross introduced the 5 stages of grief. Those are denial, anger, bargaining, depression, and acceptance. This is nothing but if any person lost any lovable human being or any valuable thing, they are crossing this stage. Okay, from the denial to acceptance. So first, we'll talk about denial. So what is denial? It's the after the child diagnosed with a threatening disease, parents used to get shocked. This is an example I'm telling here. Okay, suppose some parents got information that their lovable child is going to die because due to some any life-threatening disease. Okay, so at the beginning stage they will get shocked, and their first reaction will be denial. Okay, it means that they are not accepting the disease, so they refuse to say that this is not the real, it may be diagnosis may be wrong. Okay, this is not the truth, and they will go for another doctor for opinion because they are telling no, it's not the correct disease. Okay, this is about denial. Then after suppose they gone to somewhere and that doctor also told yes, of course your child is having this disease. So afterwards next stage they are crossing the first, from the first stage they are going to anger. So in the anger stage what is happening, parents show their feeling of anger, and also they wonder why me, I mean why my child got this problem. Okay, this is the reaction of the anger, and parents even feel very much bad why it is happening to the child only. Next, once this stage is crossed, then they are moving to bargaining stage. In the bargaining stage, parents want to restore the life of the previous one. So what they will do, they used to try many ways to postpone the death of the child. Even consequently, they start to help the other people and give donation to church, temple, orphanage. So something they want to do, bargain. This is called bargaining. If they suppose they donate some money to the church, maybe God can help the parents to to treat the child. Okay, so this is what they think. So that's why they are ready to do anything in the name of bargaining. Okay, so after the bargaining stage is over, next they are going to depression stage. During the depression stage, parent used to get depression when the condition of the child worsens. So first they were in denial, they got angry, then they are trying to bargain with the God or with anyone to save the child, but even though it is not going to happen, finally they are going to depression, and they will feel more depression when the condition of the child worsen. Okay, then after the depression stage they are moving to acceptance stage. Once the child died, otherwise it is going to die. So during the condition they will going for acceptance. So what is the here, they suffer mainly for not showing the depression to the child in the terminal and unchangeable condition. So finally they don't have anything to do, so they will accept. Okay, that's about the acceptance stage. Next we will talk about stages of the grief. So the previous one I talked about the parents grief, here we'll talk about children grief. Suppose they lost someone, so what kind of stages they are crossing? Number one is the disorganizations. At first children are expressing their grief by regression. I mean, they will not accept, and they will feel some kind of feeling. It's like we can take agitation, somewhat. And also they shows a temper tantrum. They will not accept anything. Suppose if anyone is feeding, means definitely they won't take feeding also. And they want, means they want, though this is called a temper tantrum. And even they can't able to concentrate on their daily routine. Like if they are daily playing, they won't play, they will not eat properly. And also they have mood swing. Okay, this all called a disorganization stage. Once this stage is moved, then they are moving to transition stage. In this stage, children used to feel that they are hopeless and helpless. They cannot change anything. Also, they are showing some signs, some symptoms like withdrawal, aggression. It means withdrawal, I already said that they won't talk to anyone, and they will keep quiet. And sometimes aggression, angriness also they will show. Okay. At the after crossing the transition stage, they are moving to reorganization. This is nothing but after the child output, emotional output is lost, emotional energy fades, so children feels better and they feel good to move. Okay, we can't do anything, they will accept, and finally they will remove the grief from themselves and they will go for the daily routine activities. That's all about the stages of grief for the children. This is about developmental differences of the children. So here we'll discuss about why are children thinking and feeling this way. Okay, so the first one is the birth to 3 years. Here during this stage they don't have any concept of death, even they will not have any image of object or person, but they experience the effect of the caregiver grief. Suppose caregiver is not present with them, they definitely they will miss them. Okay, and age 3 to 5 years also don't have any understanding about the permanency, what is death, they don't know. But also they are having problem that they are unable to distinguish the fact from the fantasy, because they are in dream age, so they are very fantasy about their life, but even though they will not understand the reality and the fantasy world, but they also feel separation anxiety and fear. They will understand the caregiver grief. And age 6 to 10 years, they may not realize every living thing dies anyway, but they start to understand that death is the final. Okay, and begin to use coping strategies. Then adolescence, in this stage beginning to contemplate meaning and understanding is occurs. Death, they also knows that death is the final one. Next we will talk about here effects of death of the children on family. So number one is the parental grief. Suppose parents are unable to do the routine work of daily living activities, even they are cannot nurture or support the other children of the family. If the grief is present on the parental, so there the whole family activities will be different. Okay, especially mother, she will be immobilized and unable to support her living husband and other children. If they have lost or going to lose only one child, severity of the grief will be more. Anticipatory grief affect the entire quality of the life of parents. Next one is the sibling grief. According to the developmental age of the children, they used to understand the concept of death. Okay, sibling grief means the sister and brother of the person died already. Okay, the child died already. So their understanding level will be different according to the age that we know. So according to that, the griefness will be different. For example, preschool children think that his or him, I mean her brother or sibling will come for one day. So they used to ask about about that day to the parents always. Sometimes early school age children takes blames regarding the death of the sibling on self and also grief. And the late school age children understand that his or her sibling is not going to come for life anyway. Next one is the family grief. Actual or threatened loss of the child in a family created the severe emotional disturbance among all family members. Suppose they will be in a hurry in fulfilling the demands of the child to send the death. will complete wishes without inter-acceptance. In the case of expected death, it put the family members into unexpressed behavior towards the child who has a terminal illness. Okay, and also they will be on shock, so definitely they will blame themselves for the same. Here we'll talk about management. Okay, so basically nurse has to include the child, parents and other significant people in the management process of the grief. Always nurse has to do open and honest communication regarding the actual status. She should not hide anything about the condition of the parents, otherwise condition of the child whose life is the in critical conditions. She should not show her facial expression to them. First of all, while talking, nurse facial expression should be very calm, and also she has to take responsibility of her voice during the conversation. She should carefully assess the signs and symptoms of the grief and bereavement. Suppose a child is lost, the parents are grieving, so what to do with them? So show empathy feeling towards the parents, make some arrangements for supportive system and give enough time to grieve. Okay, so sometimes nurses used to make them to hurry burry. It means you just stop and go outside, anyway child is died, so this kind of thing should be avoided. And we also provide relief from pain and other symptoms for parents also, even though they are not admitted in the hospital. Arrange religious care for the parents, allow the parents to stay with the dead child as long as they wish. Next, about grieving child. Suppose parents lost, otherwise they lost the sibling. So how you are going to deal the children? Okay, the first one is the you have to show, nurse has to show the empathy feeling towards the child. So we have to encourage to establish new relationship with other child. We can make the child have friendship with other person, give enough time to grieve, and also provide relief from the pain, fever, diarrhea and other symptoms. Be straightforward when providing explanation. We have to give proper explanation. We should not tell that your brother is will be coming after 2 days, 3 days, but even though the brother is died already, so this should not be happen. We have to give proper explanation and actual facts should be talked. So next one is the we have to provide more opportunity to play and make the child to do some simple daily activities. This is what we have to do. Thank you so much for listening me today. I hope you all understand. We'll meet you in another video. Kindly subscribe and share my video. Thank you.